Hi, Dr. Kristen Witness here, coming to you from LifeMark Nature Parkway. And today we're going to talk about low back pain, because I see low back pain all the time. And chances are you and I will experience low back pain at some point in your life. And seeking treatment is very important, and it's been shown to help. So you can see chiropractic, physiotherapy, athletic therapy, massage therapy. Everyone has their go-to for their low back pain. But the treatment that you get isn't the only thing you can do, because there's 3 exercises that I love for A, helping to reduce your low back pain when you do start to experience it, and B, to help prevent it in the future. So movement is very, very important. So just getting up and moving around. A lot of us sit and we're very sedentary through most of our day, so getting up and moving is important. But to exaggerate it just a little bit further, what I have my patients do is just march in place. So opposite arm, opposite leg. And what we're doing is really over-exaggerating that movement in your sacroiliac joint or your hip joint. So do that for about 30 seconds. And it's kind of funny because this feels like it goes on for forever, but 30 seconds isn't that long of a time, and it really helps get your joints moving. I don't know if you've heard the term, but motion is lotion. It helps to lube up those joints to keep them moving, to help them feel a little bit better. Because oftentimes with low back pain, everything just tightens up and it won't move the way it needs to. So getting extra motion in there is very important. Number 2, I love this seated glute stretch. So what you're going to do is you're just going to sit on the edge of a chair. Be careful so you don't tip forward, but also don't be too far back in the chair, because then we have a tendency of curling our backs. So you're going to sit up on the edge of your chair. You're going to bring one foot up and over. If this bothers your knee, you don't have to push your knee down very far. You can keep it up. But if your knee's okay, you're going to sit up straight. Put a little bit of pressure on your knee and rest your other hand on your ankle. You're going to sit up straight and just slowly lean forward. You should feel a really nice stretch through the hip and the upper leg. And you're going to hold that for about 5 deep breaths. And then you're going to switch to the other side. So sit up straight, one hand on your knee, one hand on your ankle. Just slowly lean forward. And that'll help loosen up those muscles that like to tighten around our hip joint. And the last thing I like to do to strengthen the low back, so this is something you don't want to do if it aggravates it, but something you can do if you have a tendency of getting low back pain. And I'm just going to lay on the table here, but you can do this on a floor. And what you're going to do is put your hands right underneath your shoulders and your nose on the ground or on the floor, wherever you're at. Then you're going to come on up. You're going to activate all of your back muscles to come on up. You can press through your hands just a little bit. If you're in yoga, you know that this is a baby cobra. You're going to come back down. You're going to lift your head up, activate your back muscles, and come back down. And you're going to do 10 of those. So what that does is it builds up all the muscles that surround your spine and your hips and helps keep your core strong. Because oftentimes when we think of core strength, we think of just the front of our core, but the back of our core is quite important too. Protects your spine, keeps your back nice and healthy. So if you have any questions, or you're looking for some extra low back pain, or you're not sure if that'll help with your low back pain, give us a call. We're happy to help.